Welcome back to Search Ahead. We carry on stretching our borders, and this time we have virtually traveled to Rwanda, where we have met Dr. Ronald Tubasiime, working as a general surgeon at the Kibogora district hospital in the western province of the country. Dr. Ronald is a graduate of Pan-African Academy of Christian Surgeons, PAACS, and COSECSA fellow from 2016. He is also a clinical lecturer at the University of Rwanda. Well, thank you for being with us. How are you?
Fine. How are you doing?
I'm doing fine, thanks. I would like to, you can give us some context. How is coronavirus affecting the country, and how is the government preventing the expansion of the virus?
For the last 2 weeks, it was still contained in the capital city, and it wasn't in the provinces. But within these 2 weeks, it came up. There are new cases that came up from the border of Congo and Rwanda. But the district that has been contained, the government has put a lockdown on that district, so that there would not be like people moving in and out to transmit the virus to other districts. And the government has been doing a very good job in dealing with it.
Rwanda is using drones and robots in order to reduce the human exposure to the disease. Is this solution, is this innovative solution reaching also rural areas in Rwanda?
Right now, yeah, as I told you, the problem was still in Kigali, and those robots are still in Kigali, but there are some drones that are in various parts of the country to try to awaken people to take measures of washing their hands and putting on masks to try to prevent the contamination.
It is really good to hear that those technological advances are reaching the rural communities as well.
Yeah, they are.
And
in fact, that is what they are using in that district where the coronavirus has been at the border of Congo, to see that all the people in various parts of the district are obeying the rules. They are taking cameras, and also they are using microphones to try to teach people.
Dr. Ronald, you have been working for 4 years as a surgeon at Kibogora District Hospital. How do you evaluate the impact this pandemic is having on the community, and how it's affecting surgery in your hospital?
Right now here at Kibogora, since I'm in a district whereby there is no case that has been confirmed so far, people in my district have been coming, and my practice has not been affected much. The only thing that has been affected are that patients from other districts had difficulties to come, because the police was on the roads, and they're preventing people from crossing these districts. Another thing that has been a problem was for the medical supplies. We get our medical supplies from Kigali, which is the capital city, and also traveling from Kigali, going to get the medical supplies, and it has been a problem. Prices have gone a little bit up, but it is not too bad. So that is how it has affected my practice, but it is not much. People are still coming, and I'm still very busy.
Thank you very much for that, Dr. Ronald. It is good news to know that it's not too disruptive. And I would like to finish the interview with a question referring global surgery. We took advantage of the celebration of Global Surgery Day a few days ago in our latest interview with one of your colleagues in Burundi. And I would like to ask you in this occasion, what do you think should be the role of global surgery in this pandemic?
I think global surgery, the role would be also not like or observing the problem from our side, but global surgery team should be fully involved in problem solving to see how can we help. Like now in Rwanda, the surgical team has been involved like in teaching the OR team to deal to know how to deal with a case that has got COVID, but presenting also an acute abdomen or an emergency of operation, so that surgeons are always ready to deal with that problem in the rural settings, so that there will not be delays and transfers to other hospitals in the capital cities or hospitals far, because those patients are critical and they need intervention very soon.
It has been a pleasure talking to you. I wish you all the best. Thanks for the time and for the interview.
Yeah, thanks. Appreciate it.
And for the rest of you, thanks for watching the interview. You can access to the previous ones in our YouTube channel, and you can always be updated of our latest news and activities, following our social media and checking our website. Take care and keep yourselves safe.